Hello, and welcome to another episode of Wellness Wednesday with Dr. Latoya Wells. I'm excited to be here with you all tonight for another episode. I am Dr. Latoya Wells, Doctor of Nursing Practice, family nurse practitioner, and owner of Wells Legacy Health and Wellness. We are a full service family practice provider, or I am a full service family practice provider. My practice services newborn, the whole spectrum of ages. We are open and we are accepting new patients. We are currently accepting some insurances: Blue Cross Blue Shield, Medicare, and Medicaid. We have a few other insurances that are pending approval. So we'll be accepting Cigna and Aetna very soon. So grateful to be here for you. For those of you who may be joining, that I met this past Saturday at the St. John's Baptist Church Health Fair. Thank you all so much for joining me. It was a pleasure meeting you all and talking to you all about healthcare and what services we offer, as well as the importance of learning CPR. There was an individual there who won a gift basket from us, who received a family 4-pack of family and friends CPR. So can't wait to meet with that individual to get her family certified for CPR. We also have another drawing that I will announce shortly on social media, and reach out to that individual who won a CPR class as well. So let's get going. We are in the month of September. And as you know, I really like to highlight several health topics, common health topics, things that we are impacted by, either ourselves or our families or someone that we know. In September, we celebrate National Alzheimer's Month, or World Alzheimer's Month, right? Where we highlight, we talk about, and we deal with all things Alzheimer's. You guys know that I brought forth many different topics this month because there's so many good things that are highlighted and that are talked about, or awareness is brought to in the month of September. I just want to send a shout out to Dr. J for my beautiful earrings. I have been waiting for the opportunity to wear them. And so tonight I decided to throw them on with this gray dress, and I think they fit perfectly. But anyhow, I want to hop into Alzheimer's, but you guys know that I love to bring you statistics so that we can see how real and relevant these conditions are and how prevalent they are within our community. So here's some statistics that I got in 2023, and we're waiting for the updated numbers for 2024. But in 2023, 6.7 million Americans were living with Alzheimer's disease. And that number was projected to increase to 14 million by 2060. Individuals who are at risk for developing Alzheimer's: as we age, we usually associate Alzheimer's disease with aging and older individuals. And then there are certain conditions, there are certain situations where some younger people may have some type of dementia as well. So we'll talk about Alzheimer's and dementia. And Alzheimer's is Alzheimer's, but then there's different types of dementia, and we'll kind of touch on that a little bit. So what is Alzheimer's? Alzheimer's is a neurological or neurodegenerative condition in which it causes memory loss. There's a cognitive decline. The mental faculties begin to change and decrease. And then there's also behavioral changes. When I think about Alzheimer's, and when I think about a typical Alzheimer's patient, it's someone who remembers a certain span of time. They may not remember family members. They may not remember living situations and things of that nature, but they do have some memory, whether it's short-term or long-term, that they're able to pull from. But these individuals begin to, over a period of time, begin to lose the ability to do certain things. And so you guys know, I like to bring everything back to the physical exam, because I feel like we all should have our physical exam. So throwing in my shameless plug, if you have not had your physical exam yet this year, it's not too late. We're still in September. You still have some time to get it done, but please go and get that physical exam done. So when we're looking at individuals from the standpoint of healthcare provider, and what I'm looking for when I'm talking to that individual, I'm asking questions that they should know the answers to. And there's a test that is performed. It's called the mini cognitive exam. And that's where we ask some questions and we have that individual do a certain thing, or we have them remember numbers and recite the alphabet in a certain manner. And what we're doing is we are looking for and we're observing and witnessing or assessing that individual's short term and long term memory. I'm getting ahead of myself. But when we talk about memory loss, there are some things that begin to change. These individuals were pretty independent. They were able to do things on their own. They were able to pay their bills. They could leave home and go to the grocery store, go to work, or go to family member's house and know how to get back. They were able to, balance their checkbook, pay their own bills, do different things, that they were used to doing all alone. When we have individuals who start to develop Alzheimer's disease, those things begin to change. And there's a slow, some people it's quick, but many times it's slow. And these individuals begin to notice that there's a change and they start to compensate for things, or they stop doing the thing that they notice there's a change. Let's just say this individual used to always drive and go meet their friends for dinner and golfing or something, right? And then all of a sudden they're having trouble figuring out how to get there or how to get back home, or they've gotten lost, or they've gone to the mall and they can't find their car. Well, that happens to me because I'm not paying attention. I'll park my car, I'm on the phone, I'm preoccupied. I'll go into the mall and I'll come back and I'm like, God dog it, where is my car? I can't find my car. But that's normal, right? It's normal for us to walk into the kitchen and have to backtrack and be like, okay, what did I come in here for? Those are normal things, especially if you are a busy person and you have a lot going on. However, if it's consistently happening and it's beginning to progress to where this individual is cooking, and maybe this is a bad example because I do this as well. But I don't have Alzheimer's. I don't have memory issues. I just have a lot going on. But they begin to make excuses like I just did. But so let's just say they're cooking or what have you, and they go and they turn the stove on and they start warming up some food or putting food on, and then they forget the food. They leave home, forget the food. A fire catches, danger is occurring, and they're putting themselves at danger. So that's just one example. But one of the biggest things that I've noticed is with some of my individuals and my patients that I've seen who have Alzheimer's, it's a slow decline, and they begin to try and compensate for those changes. They notice that the change is happening. Family members or friends are noticing that things are changing and that they're not as sharp as they once were. And so they begin to overcompensate. They either stop doing the thing that they used to, or they begin to make excuses. And so cognitive decline, we talk about cognition being, the ability, not just memory, but cognitive, being able to dress themselves, being able to button up their shirt, being able to tie the shoes, things of those natures. That is second nature, right? But now all of a sudden this individual is struggling. They begin to not be able to take care of themselves and complete the daily activities of daily living, taking a bath, washing, brushing their teeth, things of that nature. We begin to see changes in their habits or their behaviors. And then, of course, behavioral changes. Some individuals with Alzheimer's will become aggressive, especially when they have family members or friends constantly reminding them, hey, something's changed, or is something wrong? How do you keep forgetting to do this? Oh, no, I did it, but no, they didn't. And so they begin to change. What I've heard over time is that it's a slow decline. So you begin to notice one thing and then that becomes compounded and then it just gets worse. So Alzheimer's, again, is a neurodegenerative. So the neurons in the brain, there's some major changes that are occurring there. And so we want to emphasize the prevalence of Alzheimer's. It affects, as I mentioned, 6.7 million individuals. And most of these people are over the age of 65. However, we have seen Alzheimer's in younger individuals, but it was due to other situations or, special cases where we have seen Alzheimer's in younger individuals. So one, signs and symptoms. I kind of talked about that a little bit. Difficulty remembering recent events or newly learned information. Usually they're able to recall information from the past. But when we come to recent information, they have a hard time remembering those. So recent recall. Challenges in planning and problem solving. So difficulty following plans or working with numbers, as I mentioned, balancing the checkbook or balancing the bank account or paying bills and things of that nature. Difficulty with familiar tasks, so completing everyday tasks like cooking and driving. I talked about that. They forget that this person used to bake amazing cakes, and now all of a sudden the cakes aren't so good, or they aren't turning out the way that they used to because they're forgetting the recipe. They're forgetting some of the main ingredients of the cake. Driving, as I mentioned, individuals will leave home and not know how to get back home. I can't tell you the number of times that I've been on one of the interstates or highways here, and you see the silver alert on the message board. There's an elderly person who's missing and in danger because they've gotten lost. I've had situations where patients of some elderly patients that I've taken care of, their family members will come in with them and be very concerned because this individual has gotten lost and ended up in, 2 cities over, and some driven and, couldn't find their way home. And so it becomes a danger, it becomes an issue because we don't want these individuals to get hurt or get in an accident or what have you. And then you've heard many times about the individuals who are living with family members who get out and get into dangerous situation. I believe last year, I don't remember exactly when, either the end of last year or beginning of this year, there was a family vacationing, I believe in Central Florida, and the father, who had Alzheimer's dementia, got out of the house and ended up in a lake, and he drowned and passed away. And so it's situations like that. Another one is confusion with time or place, forgetting dates, forgetting seasons, getting lost in familiar places. This person goes to this park every day, or this person goes to this same Publix grocery store every week to get groceries, and they get lost and they get turned around and end up somewhere else. Changes in the mood or personality. So increased anxiety, suspicion of individuals, thinking that people are out to get you, or that people, are wanting to cause you harm or cause them harm, depression, and then withdrawal from social activities. Let's talk about anxiety for a little bit. I don't know about you, but I have gone to the mall and let me share this story. I went to Vegas for a conference. As a nurse practitioner, we have to get continuing education. And so I went to Vegas for a conference, and my cousin was with me. We went, came back. It was a red-eye flight, so we got back pretty early, had not been asleep because the late flight, early morning, getting back to OIA, and I could not remember where my car was. I don't know how much time I spent trying to find my car that I began to get very frustrated and very upset, and some anxiety began to set in because I'm like, did somebody steal my car? Did I, what's going on? It was just as simple as me going to the parking office and asking, and they were able to locate and tell me where my car was. But I have had situations where patients have come to me and said, I could not find my car. I had to call a family member, or I had to call, they had to call the police to help them find their vehicle and help them get home. So things like that. And it's a slow progression, and many times it doesn't happen overnight. There's subtle changes that begin to happen. And then you begin to see, more things that are changing. Misplacing things, so putting items in unusual places and being unable to retrace your steps. Remember, I talked about earlier that, when we get up and we go into a room and you're like, what did I come in here for? Well, I can retrace my steps and go back into that room. Like if I'm in my bedroom and I'm coming into the kitchen and I'm like, what did I come in here for? If I go back to my room and just stand there for a moment, usually I remember what it is, that depending on how much I'm thinking about and what I have going on, or how, busy I am. But these individuals, they can't seem to retrace their steps. They will put the remote in the refrigerator or in the freezer and then get very upset and anxious when they can't find it. They accuse family members of stealing things or, hiding things from them. When it comes to depression, they begin to get depressed because they know something is going on. And then family and friends are making mention of certain things that are happening. And it causes them to want to withdraw and to get depressed. And usually when that happens, once they start withdrawing, it's a downward spiral for some of these individuals, unless family and friends can, step in, or medical professions can step in and help those individuals. So what are some risk factors for developing Alzheimer's? I kind of talked about that a little earlier. And I'm sorry, my glasses are falling off my face. I ordered some new ones, so I'm excited for them to come in. So being over 65 years or older is a risk factor. And those individuals in that age bracket, 65 and older, are at the highest risk for developing Alzheimer's. Having a family history. So family history and genetics, it can be linked back to genetics. So if you have a family history of someone in your family who has been diagnosed with Alzheimer's, then there's two things. You're older, and then you have a family history of it. Lifestyle and heart health. So focusing on factors like obesity, high blood pressure, smoking, and diabetes can also affect the brain and cause changes to happen, which can further lead to the possibility of developing Alzheimer's. And then head injury. So past traumatic brain injuries may increase the risk as well. Some early detection. So how do we detect it? There's some brief cognitive tests that are administered. Remember, I talked about the mini cog exam. What we do with those exams, and there's many different ways that you can do this. Typically, what I do is I'll give that person 3 words: bird, apple, tree, or bird, 3 non-related words. So penny, apple, table, penny, apple, table. And I'll have that person repeat those words to me: penny, apple, table. Then what I'll do is I'll give them a paper. I ask them to draw a clock, make the circle, put all of the numbers on the clock, and I'll have them to set the time at 4:15 or 4:55, right? And then I'll go about the exam, finish asking some additional questions, and then I'll come back and ask, okay, so I see your clock is good. You were able to draw the clock really well, put the numbers in the right place, the hands, both the minute and the hour hand are in the right place. Can you please tell me those 3 words? If they give me those 3 words and they're able to recall, then they've passed the test. If they were able to draw the clock, they've passed the test. What I've noticed is that individuals who have some issues or who may exhibit some signs and symptoms of Alzheimer's or dementia have a hard time drawing the clock. There's an issue with spatial recognition. They're not able to draw the clock, the circle completely, or if they draw a complete and correct circle, they're not able to write the numbers on the clock correctly. Or if they do that, then they don't remember where the hands go on the clock. I had a discussion with a colleague not too long ago, and we talked about the digital age. Who wears a watch anymore? Who wears a watch with the hands anymore? I don't know if you can see my watch. It's gone off. But my watch doesn't have hands anymore. I can put the hands on there, but I just look and it says 6:48, right? I don't have the one with the minute and the hour hand, and I don't hear it ticking. Well, I do have them, but I don't wear them because they're not fashionable. I can't change the bands. I can't put the cute pictures on there. And most of us, what time is it? I don't know. Let me see. We look at our phone, right? How many of you have actual clocks in your home? And we talked about how society is going to be in trouble. We're going to have to think of a way to assess individuals from a clinical standpoint with a mini cog exam that does not include the clock, because there are individuals now who do not know how to draw a clock. I had an individual draw a digital clock for me one time during an exam, and it's because they said I don't own a clock. I own a watch, but it's a smartwatch, and so we're gonna have to be very intuitive when it comes to that. But the exams that are administered by the doctor, some individuals, and there's some different tests, and your healthcare provider may perform a different test from what I'm accustomed to. We can have the individuals recite the alphabet or recite numbers backwards or in a certain way, or count the numbers by 5 going backwards or what have you. But what we're looking for is short-term and long-term memory. If I give you something to do right now, if I give you something to remember that you're going to recall, which is long-term memory, and I have you draw a clock and put the time on there, short-term memory, I want to see if you can remember those words, right? When we talk about the regular healthcare checkups, as I talk about all the time, we want to make sure that you're getting your physical exams every year. In some situations, you may be seeing your healthcare provider every 3 to 6 months, depending upon what's going on. So regular checkups, when you're talking about the family history, it's important to find out. And when you're at your healthcare provider and you're getting your physical exam, we want to know family history, your social history, past accidents, traumas, injuries, what have you, because that can all play into your current health at the moment, depending on what's going on. We want to look at family members as an individual, and I have a family member that I think may have Alzheimer's or have some cognitive changes. We want to look at their memory. Are they forgetting things? Is their mood changing? Some individuals with Alzheimer's can become very aggressive and combative as we get toward the end stages of it. And so I've taken care of patients when I worked in hospice who had a diagnosis of end stage Alzheimer's dementia, and they were on hospice because they declined so much that they weren't able to eat, they weren't able to take care of themselves, and there was really, nothing else that could be done. And families decided to put these individuals on hospice. There are medication, there's different things that can be done to help slow the progression of it. But as of right now, there is no cure from a medical standpoint for Alzheimer's dementia. So looking for intervention and things that can be done is to screen early, and for family members and those individuals around those people to know what to look for. We are in September, and I don't know if you guys have heard, but there's Alzheimer's walks that are going on all over. I know my team and some others that I know will be participating in some of the Alzheimer's walks. And what these walks are doing, just like the breast cancer walk, just like many of the other walks for some common health conditions, is it's raising funds to help fund research and to help provide resources for individuals who are dealing with, or families who are dealing with Alzheimer's. And so there's the Alzheimer's Association. It offers 24/7 helpline for families to provide education and support for individuals with Alzheimer's and families. And then you have the caregiver support services. I have not personally taken care of a family member with Alzheimer's, but I was witness to a family member being cared for, right? My husband's grandfather had Alzheimer's, and when I met him originally, he was alert and talking, and then you could begin to see the decline to a point where mother wasn't able to really care for him at home. And so the decision was to put him in a nursing home where he can get care. But you begin to see that decline, right? And it's hard as family members to watch our family and see them declining and see them changing and becoming more independent, more dependent, whereas before they were very dependent and able to care for themselves. When it comes to caregiver support, there's services and there's resources for in-home care. So you may be able to get support to have someone come in and help you with cleaning and taking care of that individual. There's also respite care. So if you have to go, if the caregiver or the family members have to leave and go away, go out of town, you can get those services where someone will either come to your home or that individual will go into a facility for respite during the time that the family member needs to be away. There's local support groups. We have the Central Florida Alzheimer's and Dementias Resource Center. I have a friend right now who is dealing with something like this with her mom, and it's challenging. And she and I have had some conversations about it. But if the individual doesn't acknowledge that they have a problem or that there's something that's going on, then it's hard to help. And so when it comes to like the legal and financial planning, there's resources to help navigate that, because once this individual is not able to, they're no longer deemed competent to make decisions on their own. Paperwork and processes already need to be in place before it gets there, especially if there's property and finances and things like that involved. It's so important that the family have those discussions and that you have the paperwork in place in advance. So Self-planning, like legal and financial care planning, what's going to happen when that individual can no longer care for themselves. Have those hard conversations early while it's easy to have those conversations versus when things have drastically changed, emotions are involved, family members are not necessarily all agreeing at that point. Make sure you have those things in place. Some of the things that I want to leave as the takeaways for you guys and just some tips. One, plan ahead. If you have a family member that is going through this, have the conversations now. Talk with the healthcare provider now. Get the legal paperwork in place now so that when things begin to change and that individual is no longer able to make decisions for themselves, whether it be financially, whether it be social, whether it be their healthcare, they have their wishes written down and in place. And then that way the family already knows what the plan is and you don't have to try and figure it out in the moment. Alzheimer's, again, as we mentioned, affects millions of people, but we have to make sure that we are aware, which is what I'm doing, is making sure that you are aware that you have the knowledge and the information that you need to be able to make decisions for yourself and your family member. Early detection. So getting those screenings and getting, going to the healthcare provider or talking to someone if you suspect that yourself or a family member is dealing with Alzheimer's or developing Alzheimer's, because there can be, things that can manage it. It can help prolong things in the decline of it. Every year, there's many advances in healthcare that are geared towards Alzheimer's, dementia, and can be very helpful. I want to make sure that we take in this information, that you share this information, and that you're participating in the local Alzheimer's walks, and that also help with research. And then there's ways that we can become involved as a community to get involved in the local organizations, help volunteer, help, spread the news and information to others about what's going on and what's happening within our community. Even more now, we have more seniors who are living alone, who are battling with health conditions that no one knows. And as I'm getting emotional, as someone who lost my grandmother, not to Alzheimer's, but just wishing that I had more time with her and that I could have did things differently and that I could have spent more time with her, that I could have gone over more frequently, or I could have called more frequently. There's things those are conversations that I have with myself, and those are thoughts that I have. If I could have, should have, would have, what could have changed that? If I had talked to her more about our family history, then there won't be this void in trying to figure out, like, who are we related to? Have those conversations, make those connections. Let's love on our seniors and our elders. Let's let them know that they're not alone and that they don't have to go through these things on their own. It can be scary as an individual to not remember things. I remember I had a concussion and I just could not remember. I couldn't remember passwords. I couldn't remember certain things. And that was scary for me. But I knew that was going to be temporarily, right? But individuals who have dementia, it's a decline, a slow decline, and they notice the change in themselves. And many of them are terrified of letting individuals know that something's wrong. When we speak of dementia, it's similar to Alzheimer's, but are they one and the same? Kind of, but not really, because there's many dementias that can come from other things. And I just remember being younger, and one of my aunts had a friend, and she was diagnosed with a type of dementia, and it was too much for her. And since we're in National Suicide Awareness Month, we have to highlight it. This individual committed suicide because they just could not bear the thought of dealing with a diagnosis of dementia. And so we have to be a support for those in our community and within our family. If I can leave you with anything tonight, it is make sure, several things. Pay attention to the signs. Watch your family members. Know them so much so that if something changes, then you can pick up on it before it's too late. Get your physical exam every year. Many things can be picked up on your physical exam that may be missed, that may be seem, incidental, but it could be a big deal down the road. Another thing, let's love on our neighbors. Let's love on our seniors, those elderly individuals in our community, in our churches, our family members. Take time to spend time with them and to talk with them and let them know that they are not alone. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. If you are in need of a primary care provider, give us a call, 321-306-6755. Stay safe and be well. Until next time, have a great evening.